Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everybody. That's here. Okay, I will introduce our next speaker, Professor Saiful Huq, whom I know him for a long period. He's the vice president. He's the vice president for this AMSTRO. I'm very supportive for this event. He's a distinguished medical physicist and leading figure in radiation oncology across the world. Served currently as a professor of radiation oncology at the University of Pittsburgh. And he is well known for contribution and help in supporting radiation oncology and radiation physics as a whole in low and middle income countries. He's been recognized by several associations and societies. And recently won the U.S. Gold Life Medal Award for 2025. Welcome, Professor Saiful Huq. He will be talking about the AI-powered cloud-based comprehensive medical centers, comprehensive cancer centers, actually.
Thank you for that kind introduction. Good morning, everyone. So I'll talk about a technological solution that's called Comprehensive Cancer Center in the Cloud, powered by AI, or C4. This solution will democratize. It has the potential to democratize cancer care globally by building capacity and increasing access and equity. So what is C4? It's a virtual ecosystem that is powered by AI and cloud technology that brings the expertise of a comprehensive cancer center to every patient close to their home. So, and this is something we'd like to bring to the AMSTRO region. So let's imagine the different possibilities that this comprehensive, that C4 technology, integrates in terms of its capabilities. So I have to learn again. So yesterday I had a lot of trouble. So let's just listen to this, some possibilities.
Imagine a world like the one that John Lennon described. Imagine world-class cancer expertise, Harvard, Hopkins, UPMC, accessible through an AI-powered platform. Imagine affordable, continuous, and sustainable cancer care delivered worldwide. Imagine a fully integrated system, no fragmentation, no lost patients. Imagine beyond telehealth, prevention, diagnosis, treatment, follow-up, palliative care, mental health, research, and universal trials in one place. Imagine instant global access through mobile or trusted community healthcare points. Imagine geography, income, and time no longer barriers, precision medicine for all. Imagine AI-driven early detection catching cancer before symptoms appear, reducing costs and saving lives. Imagine global specialists collaborating via virtual tumor boards. Imagine top treatment recommendations within hours, anywhere. Imagine universal access to life-saving clinical trials and experimental therapies. Imagine AI-assisted counseling, remote monitoring, and community-based support. Imagine a system that helps patients and caregivers navigate emotional and psychological challenges. Imagine a global oncology hub connecting experts with AI-driven insights and the latest breakthroughs. Imagine accelerating collaboration and innovation to push the boundaries of cancer care. You may say I'm a dreamer, but I'm not the only one. John Lennon and all of us
So just imagine you put all of this integrated in a package somewhere in the cloud, where every patient anywhere in the world will have access to this. That's how we can democratize cancer care. So this is a transformative idea, and it's going to transform how we care for our patients in the future. So this C4, it unites 4 pillars: care, outreach, research, and education. It all puts it into an integrated solution as opposed to the fragmented solution that we currently have. And the C4 component includes many things. I'll just mention a couple of them. Tele-oncology consultations, low-cost, AI-driven diagnostics like multi-omics blood tests, personalized treatment, mental health support, all accessible to a patient close to their home. Oops, sorry. So the outreach component, so it engages the communities and the local leaders to deliver culturally sensitive care, with your social workers bringing testing and different medicines, again, close to patients' home. The research component really connects all the researchers from around the world together to accelerate innovations. And the education component, you have heard about it, Will talked about it yesterday, the access to Global Oncology University, through which you can train our professionals. So let's look at each of these just in a little depth. For research, we need to do the clinical trials for diverse population. We need to have quality control and quality assurance programs in place. We need to collect data on various omics data and perform all kinds of research to determine really what will be the best data, the drug, and the modalities for the treatment of a patient. Education, we need to really train our professionals and increase awareness among common people about cancer. And we talked about GoU yesterday, or the Global Oncology University, through which we will be able to train our professionals. You'll have access. People from anywhere in the world will have access to the best educators. Just imagine somebody, at a remote place in UAE now have access to the best teachers at Harvard or Hopkins or some other places, and vice versa, right? It's a two-way street. You just don't learn from only Harvard or Hopkins. Those folks also have a lot to learn from the, in the other parts of the world also. So it's a two-way street. So that's, and then through this GoU, you can have a theoretical, the knowledge. The practical aspects of it can be facilitated by working with the accredited cancer centers, like IAEA has all these different anchor centers where professionals can get the hands-on training. And then there's the continuum of care, right? First we have to think about prevention and risk reduction. And in many of the low and middle income countries, the patients present at an advanced stage, right? So if there is one detects cancer, then that has to be followed up by diagnosis and treatment and follow-up and the personalized care. Okay. I have to learn how to, Mac child, that's the problem. And then, so what we want to do is provide a comprehensive solution where everything is integrated by an AI solution. The AI solution should be such that it optimizes every step of the way along a patient's journey and and ensures that everybody along the journey is the communication so that one knows, what the care of the patient should be at different stages. And then there are, the different barriers that we talk about. We may have a fantastic cancer center or a diagnostic facility, but patients, they may not be going to those places because there may be potentially economic barriers or geographic barriers. So we need to overcome those barriers so that we can actually facilitate the care for these patients. We need to really have an AI-driven system that will increase efficiency, right? We need to collect the different omics data and analyze them so that we can stratify the patients appropriately and can predict what will be the best drug or the modality for a given patient. And then there are global standardization of cancer care, right? A physician may be at a given location where there is that physician do not have any possibilities to really consult with other peers. And if a patient presents with an unusual situation, then the patient may not get the best care. So we need to, this solution provides or facilitates bringing all the knowledge to the cloud, whereby all the different physicians now can do a peer review process. And mental health is an issue, right? We do not talk about mental health of the patients. So, the solution, the AIs, there has been some research done at the Imperial College in London, where they found that you can actually use chatbot to provide mental health support to patients, where a social worker can be trained appropriately to provide with the support from the chatbot, and sometimes trained by the appropriate professionals, to provide mental health support to the patients. So, and then there are situations where patients do not go and seek care, and that's one reason why patients, particularly in the low and middle income countries, they present themselves at a very advanced stage. And there are many reasons, again, why patients do not seek care. For example, they may not have access to the care, or they may not even trust the physicians, where they go to seek their care. So, and if the patients are not coming to the facilities, then we need to, what we can do, as they say, if Muhammad doesn't go to the mountain goes to Muhammad, right? So we can actually bring the care close to patients' home. We can bring mobile CT, we can bring ultrasound units, we can bring mammographic units at a center in a community center close to the patient, right? And when the patients are familiar with their local population, they will, that way you increase the access to care. And then all these facilities can be connected by AI solutions to the cloud. So, and then, in order to do that, there has to be a sustainability. So the program that you develop has to be sustainable, and there are many ways to do that. And we can charge a fee to the center, to the different cancer centers who will be getting access to these solutions. Or an important way is to really reduce the price of the drugs. It can create say, for example, if you're treating a patient with Pembro, it costs about $150,000 to $200,000. Now, higher than if you create biosimilar solutions that will reduce the price of the drugs. So there are ways to really create a sustainable model for all of that. And an important thing is early detection, right? When we see the patients at an advanced stage, the cost of care is about 4 times as much as if we see a patient at an earlier stage. And that when you see a patient at an advanced stage, also the survival goes down, right? So you're really, at that time, it's really enhanced extending the patient's life with some quality of care. So the AI C4 really is an approach where you integrate all these different things in a cloud solution. And then when you put that, just imagine you're the best cancer center in the cloud with all the different possibilities. And now if you connect multiple centers, it's a hub and spoke model, say, for example, to this cloud, and then train all of these centers, the professionals, to the same level as the advanced center. Then every center is trained to the same level. Then the patients who are all served by these centers, they all will get the same quality of care. And everybody will have access to the best in the world. So that's really the concept. So let's take a couple of examples of how does AI make this happen? And I'll look at in the space of diagnostic therapy, holistic care, and access to drug delivery. So how does AI make it happen? So for example, AI enables low-cost decentralized diagnostics. What that means is, for example, a social worker at a small clinic at a remote village can use a portable point-of-care device, as small as your smartphone, right, to collect a blood sample for a multi-omics liquid biopsy, right? This test analyzes your genomics, proteomics, and metabolomics biomarkers, like the circulating tumor DNA, to detect cancer early, right? So the device then uploads the data in the C4 cloud, where you have AI models that are trained on millions of such biomarkers, and it really provides a diagnosis with about 95% accuracy in hours. You don't need a hospitalization or other solutions. So it becomes really an expensive way of doing this. And those of us who are in the radiotherapy world, we already know that when a patient comes, right, what happens? Patient comes, the physician sees the patient, and I'm looking at my time also. Physician looks at, makes a decision that you want to treat the patient through radiotherapy. Now, by the time the CT scanning is done, we have all these AI solutions now that draws all your contours, right? And then after the contours are done, the solutions everything is being automated. There will be automated solutions for target delineation, and this system can actually generate 4 to 5 plans. And the physician can then access those plans remotely, make some tweaks and stuff, and approves the plan. There can be peer review that can happen. And then there are automated solutions, the medical physics, that the QA and that we do. So in a way, everything is fairly getting automated from the planning to actually target delivery. And there are ideas now that are coming up where if you get a diagnostic CT done, by the time the patient comes to see the physician for consult, the physician will have in front of him or her an entire solution that this is how you are going to treat this lung patient, and these are the 4 options for you to do the treatment plans that are done. So the entire process is getting automated. And then the C4 AI provides holistic support. It monitors patients at home, their vital signs. They're tracking the different omics data from wearable devices to see if there are any complications that may arise. And should a complication arise, it can alert a hospital close to patient's home so that the patient's care is not compromised. And I mentioned the C4 AI also provides your mental health support through chatbots that are trained to offer counseling. And they're reducing anxiety and depression for these patients. And we know about 40% of these patients suffer from that. C4 AI ensures access to medicines. This AI optimizes the drug supply chains, predicting the drug needs and for a particular patient at a given location, and then coordinates the delivery of your targeted therapies or other drugs to a place close to patient's home, thereby ensuring that a patient will not go without any drug. So to summarize, the AI C4 will integrate advanced technologies that will revolutionize cancer care globally. It will democratize access to high-quality diagnostic and therapeutic services and other support services. It will overcome geographic, economic, and other barriers. It will establish a sustainable and scalable healthcare model. It will foster collaboration and commitment to equity, one of the major themes of this conference here. And it will create a future where all individuals, regardless of location, will have access to the state-of-the-art cancer care. And these are the colleagues who are really very much focused in pushing this concept and the technology. There used to be 3 musketeers that have become 4. Now we are growing slowly. There are 5 of us in there. Thank you very much.